have.
That's right.
Give us the latest update. I saw yesterday that the folks from Samaritan's Purse had arrived here in Mississippi to set up their field hospital. Tell us a little bit about that.
So there's been a lot of activity going on in the last week to 10 days, both with the Department of Human Services, with the State Health Department, the Governor's Office, MEMA. First we have deployed a field hospital in the lower level of Garage B. And now through communications that really started kind of midweek last week, Samaritan's Purse sent a scout team here and did a lot of legwork over the last 3 or 4 days with our teams, looking at the possibility of setting up a second field hospital. So that is now well underway. It was at some point over the weekend that we got the final green light to do that. And as I said, it is well, I think that was Saturday night, but it is well underway now. The tents are going up, the equipment is being gathered, the medical teams are being assembled, and it is our anticipation by the middle of the week that they will have that site operational in Garage C.
And from what I understand, the Samaritan's Purse up is going to include some ICU capacity that you can tap.
That's right. So it will include some ICU capacity, which will be a very welcome relief. Over this next 24 hours and 30 hours, those exact details of the arrangement of the beds are being developed and were being worked out. But we do know that it will include some ICU capacity. And they're just looking at the needs to determine ICU level. Then there's kind of an ICU step down level. So they have some flexibility, which is very much appreciated, and they'll, as I said, be working to finalize those plans over the next 24, 30 hours.
Now, I hate to ask you this question, but we have to get the information out there. After last week, where we broke our single-day case record 3 times in 1 week and into the week on Friday with over 5,000 new cases, and I suspect when the number comes out here in a little while for the Friday, Saturday, Sunday period, I referred to it earlier this morning as what I expect to be an eye-watering number when we see it. What's the current status at the hospitals and specifically there at UMMC in terms of your capacity? Where are you at?
So I looked at our numbers this morning, as I do every day, and in anticipation of your asking this morning, based on our 7 a.m. report here at UMC, we are negative 34 beds, and out of that negative 4, it's 18 med-surg and negative 16. So that means we've got that many patients that are admitted and are being held and waiting on beds. Across the state, there are a few ICU beds that are open. There are 6 or 8 that were reported open this morning. But just looking at the numbers I gave you from our place and knowing what's happening everywhere, those beds will fill up quickly. So it's just a matter of time. Every time an ICU bed or a med-surg bed opens up, there are multiple patients waiting to then fill that bed. So, there are moments when we have beds that are open, but there's a lot of demand for those beds. And I fully expect, as you mentioned, that we will see a large number this morning when the Department of Health new case numbers come out. And I expect that will continue through the week, that we'll see numbers that are surprising to us and possibly even new records for the state. On the health system side of things, when we see those large numbers, we know that few days, weeks, that's when we really feel the impact of those new cases. So we are bracing. Our own internal number of COVID patients jumped by 20 from one day to another over the weekend. Yesterday we had 121 or 123, and this morning we have 141. So, we are seeing our own numbers pick up. It's happening everywhere across the state.
Well, and I'm glad you brought that up because that's one thing that I think gets lost sometimes. Friday, we had a number over 5,000. That takes a little time for those cases, once they're detected, to reach the point where some of them will require hospitalization or an ICU stay or, heaven forbid, a ventilator. So when you see a number like that, you know what's coming down the road in a week, maybe 2 weeks even. It just depends on the individual cases. And as the numbers continue to stay high, you know that it's not going to be a quick peak and then drop back down. You've got a tsunami coming in if you go by those numbers. And if you would just talk briefly why we know that, why we know that if you get a number and you break the record 3 times in 1 week, you're going to see a lot more hospitalizations, and you know they're coming. It's not a guess. You know it's going to happen. Talk about that for just a second.
So that's been our experience for this last year and a half in this pandemic. And particularly early on when we saw the numbers of new cases, at that point, it took about 10 days or 2 weeks to really feel the impact of those patients needing hospitalization. With the Delta variant, that runway has been a little bit tighter. So we see high numbers, and it doesn't necessarily take 2 weeks before we feel the impact of that related to hospitalizations. It seems like people are getting sicker quicker, but we've been tracking this for some time, and we're monitoring it and watching it. And we do sort of, we know that we see these high case numbers, and we know the hospitalizations will follow, and that then the ICU numbers will follow, and the deaths. And that's just kind of the most gut-wrenching part of this. You look at 5,000 new cases a day, and you know that about 2% of those, just based on our track record for this last 18 months, won't make it. That's 100 deaths from 1 day's report of cases, and that is very, very sobering. When you think about the timeline and you look out, there is almost nothing that we can do today to salvage August. I mean, we are going to have a rough August, and I hate to say it, but the reality is September is not looking good either. If we want things to look better in October and November, what we have got to do is slow down this spread and really tamp this down. And, I feel like a broken record, but the way to do that is for people to get vaccinated right now and for people to wear masks. I know that some people, I've even heard people express it to me saying, oh my gosh, well, it's so bad I hadn't gotten vaccinated, but what's the use now? And I'm just trying to be sure they understand that, oh my goodness, it's not too late. It is not too late. It's too late to make a difference for August, but not for September, not for October and November.
You would think we would start to see a changing of the general attitude because in comparison to last year when we hit our peak at the end of last summer and it was bad, but it wasn't this bad. Now, I can't find anybody that doesn't have a close friend or family member that isn't suffering through this, and most people know at least one person who's having a very bad time with it as they have it. So you would think some of those personal experiences would start to sway some of the undecided people, you would think.
Right. And last year, this time when we were having these conversations, it was all about the hope and the excitement about the possibility of, by the end of the calendar year, having a vaccine to help fight this. I would not have believed that with the availability of a vaccine at the end of last year, early in this calendar year, that right now we'd be having the conversation we're having.